Hi, my name is Stephanie Sutton, and I'm here today to talk to you about how to take a blood pressure manually. By taking a blood pressure manually, it's less likely to be inaccurate compared to automated machines. Manual blood pressures can be inaccurate due to human error or misuse of the equipment. Most people that take blood pressures have been properly trained and they know exactly how to use the equipment that they are given to use. Automated machines can give false readings, and also due to miscalibration, they can also give false readings, which would mislead a patient into thinking that their blood pressure could be high or low, causing them to be put on medications when maybe they're not necessarily meaning to be put on medications. Automated machines have to be calibrated every 6 months, and if they're not, it can also cause the machine to misread and give the false readings. When taking a blood pressure manually, you will need a stethoscope. And this is what a stethoscope looks like. This piece goes into your ears, and this is the part that will pick up the actual pulse of the patient. You'll also need a blood pressure cuff. These are also marked with arrows of where you need to make sure it's lined up with the radial artery, so that when you place it onto the patient's arm, you need to make sure that the radial artery is lined up with these arrows. Now I'm going to have somebody come in and help me. They're going to be my patient today. You're going to come sit right here for me. Can I have your arm, please? You always want to make sure that you're explaining to the patient what you're doing to them. You're going to ask them for their arm. If they willingly put it out, that's automatic permission, as is what they teach us in school. You're going to take the cuff and you're going to make sure it's straightened out completely, that the patient's arm is straight up. You want to see the inside of their arm straight into the air. You see where the arrows are lined up? It says left or right arm. I'm using his left arm, so you need to make sure that the arrow is lined up to the far left of his arm. This is what we call the radial artery. You want to wrap this around snug, not tight, because once you start pumping the air into the blood pressure cuff, it's going to get tight. You can tuck that into there to hold it. You want to make sure that you can also see the gauge here. The gauge is going to show you how much you can pump it up. This is measured by mercury, is how it's measured. You're going to stick the ear part into your ears. You can tap on this just to make sure that you hear it. Don't do it too hard because you can hurt your ears. You're going to place this right into the fold of the elbow on the inside of the arm on the radial side. You're going to let your patient know that they're going to feel a big bear hug on their arm. That's what we tell the kids. And you're going to pump it up to whatever it's called for each patient. A child is going to be different than an adult. Adult's going to be different than a child. Now you're going to listen for their pressure. His is about 86/44. The way to tell you how to do this is you're going to listen for the very first part of the heartbeat. The first heartbeat that you hear at the number, that's going to be your top number, which is your systolic number. The bottom number that you hear, when you no longer hear a heartbeat, that last heartbeat that you hear is going to be your bottom number, and that's going to be your diastolic. So you have your systolic and your diastolic. So his was 82/44, which for a child, that's really good. Once your patient is done, of course he's out of the room, but they usually stick around. And that's how you take a blood pressure manually.